is originally developed by Makat Ikovic, Sarah Abubat, Naomi Katz, and Betty Al-Azhar. Original Lotka is published in 1990. There are 6 versions of Lotka. Lotka takes approximately 45 minutes to administer, which is suitable for clients above 6 through 70 years old, and there are 6 languages available. The purpose of the assessment is evaluating basic cognitive abilities in brain-injured clients. Besides, the evaluation is useful for establishing a baseline for treatment, planning treatment goals, and monitoring changes during treatment. Lotka can be used for this type of patients. However, according to Josman et al. 2010, an individual's culture can affect the construct validity of the Lotka when used with a pediatric population. There are 6 components of assessment: orientation, visual perception, spatial perception, motor praxis, physiomotor organization, and thinking operation.
Assalamualaikum, Miss.
Waalaikumsalam.
Good morning.
Good morning.
How are you today?
I'm good.
Alright, today I'm going to assess your cognitive abilities by using Lotka assessment.
Okay.
You don't have to worry, as all the information or result throughout this assessment are private and confidential.
Okay.
If you feel uncomfortable, tired, and unable to continue the assessment, just tell me and we will stop and continue in the next session.
Alright.
For the first assessment, I will ask you about your orientation in place and time.
Okay.
So for the first question, where are you now?
I'm in OT clinic,
In what city are we now?
Puncak Alam.
Okay. Where do you live and what is your exact address?
I live in Polish Dahlia in UiTM Puncak Alam.
Where were you before you came in here?
I was at my hostel.
Okay. For the next question, I will ask you about orientation for time.
Okay.
First, what day is today? What month and what year?
Today is Friday, 2nd November 2018.
Okay. At what time do you arrive in OT department?
At 9 AM.
What time is it now?
About 9:30 AM.
And how long have you had difficulties?
About 6 months ago.
Okay.
For orientations of place and time, the total score is 8 points. Client is given 2 points for each correct answer. In the case where client gave a correct answer only in the multiple choice way, client will get only 1 point. 1 point will indicate minimal performance, while 8 points indicate maximal performance.
In object identification, client is shown card of 8 everyday objects, which is chair, teapot, watch, key, shoe, bicycle, scissors, and glasses. Client is asked to name each object.
So for the next assessment, I show you the picture. Can you name each of the object of the picture?
Chair, teapot, watch, key, shoe, a bicycle, scissor, and glasses.
If client has expressive problems and is not able to name the object, she is shown the first 2 bars of the test booklet and is asked to point the object named by the therapist.
There are 8 pictures and I will ask you to point out the object that I said in the booklet.
Alright.
Where is teapot?
Here.
Where is chair?
Here.
Where is watch? Okay, where is bicycle?
Here.
Where is scissor?
Here.
Okay, where is glasses.
Here.
Where is shoe? Where is key?
Right here.
If the client has receptive problems, therapists will show clients the 8 cards which are similar to pictures on the first 2 pages of the booklet.
I will show you a picture,
Okay.
and you will point out the picture on the booklet, and I will demonstrate this for this picture.
Okay, I got it.
In visual perception, the total score for object identifications are 4 points. 1 point indicate client identifies only a few objects by exact matching, which is less than 4. 2 points, client identifies 5 to 8 objects by exact matching. 3 points, client identifies at least 4 objects by naming, understanding, or similar matching. And 4 points, client identifies all the objects by naming, understanding, or by similar matching.
In shape identification, client is shown 8 shapes illustrated on separate cards, and therapist will ask client what is the name of this shape.
Circle,
Okay.
square,
Okay.
semicircle,
Yes.
trapezoid,
Yes.
diamond,
Mm-hmm.
and hexagon.
Okay. Good.
If client is unable to name the shapes because of expressive problems, therapist will ask client to point the target shape on the board in the test booklet.
Okay.
In the booklet, and I want you to show the shape that I mentioned in the booklet.
Okay.
Okay. First, I will demonstrate. I will ask where is the circle, and you will point out the circle.
Okay.
So, I will ask you where is the triangle.
Triangle. Here.
Okay. Where is the rectangle? Are you sure?
Here.
Okay. So where is the square? And where is circle? Okay. Next. Are you sure? Try again. Okay. Where is the semicircle? Okay. Where is the diamond? And where is the trapezium? Okay. Good job.
If client has receptive problems and is unable to identify the shapes by understanding, therapist will show her the 8 cards of similar shapes and ask to point to the similar shape on the booklet.
Okay, there are 4 pages of the picture of the shape, and I want you to point out the shape that I give it to you. Okay, for example, for this picture, and you show like this.
Okay, I got it.
Okay, so first picture, are you sure? So next. Okay. Are you sure?
I'm not sure.
Okay.
Yeah.
You can try again.
Yeah.
Good. And for the last picture.
This one.
Okay, good.
The total score for shape identifications are 4 points. 1 point, client identifies only a few shapes by exact matching, which is less than 4. 2 points, client identifies 5 to 8 shapes by exact matching. 3 points, client identifies at least 4 shapes by naming, pointing, or similar matching. And 4 points, client identifies all the shapes by naming, pointing, or similar matching. In overlapping figures, therapist will show client 2 cards of 3 overlapping objects on each. A is banana, pear and apple. B is pliers, hoe and saw.
Okay, I show you this picture and I want you to tell me what do you see in the picture. This one first? Okay, yes. This one.
Apple,
Okay,
banana,
okay,
and pear.
okay, good. For the next picture?
Pliers, saw,
Okay,
and a hoe.
okay, good job.
If client has difficulties in identifying the figures, therapist show client a board with the 6 separate figures.
Okay, there are 2 pages of the picture and in the booklet, and I will show you a picture in the card first. Okay, so I will demonstrate to you. First, I saw banana, and you point out banana.
Okay, got
Okay.
it.
Okay. Okay. And for the second picture. Okay. Okay, good.
The total score for overlapping figure are 4 points. 1 point, client does not identify any figures or identify less than 3 with the aid of the board. 2 points, client identifies 3 figures with the aid of the board. 3 points, client identifies 4 of the figures without the board or all the figures with the aid of the board. 4 points, client identifies all the figures without the board. In object constancy, client is shown 4 photographs of objects taken from unusual angles, which is car, hammer, telephone, and fork.
Okay, I give you this picture and I want you to tell me what do you see in the picture.
A fork,
Okay.
car, hammer, and a telephone.
Okay, good.
If client has language disability, for example aphasia, and only in that case, therapist should use the multiple choice board.
Okay, first look at the big picture
Okay.
and look for the same thing in the small picture. Such as for the first picture, this,
Okay.
which is a car.
Alright.
Okay.
Okay.
And then we'll proceed to the next picture.
This one?
Are you sure?
Okay, this one.
Okay. The next picture.
Okay, I got it. This one?
You can try again.
Yeah, this one.
Yeah, that's right. And then for the last picture,
This one.
yes, good job.
In object constancy, the total score are 4 points. 1 point, client is unable to identify any object or identifies only one. 2 points, client identifies 2 objects. 3 points, client identifies 3 objects. And 4 points, client identifies all the 4 objects.
Show me your right hand. Show me your left hip. Put your right hand on your left ear. Put your left hand on your right leg. On which side of you is the door?
At my back.
On which side of you is the table?
On my left.
And on which side of you is the window?
On my right.
On which side of you is the bed?
In front of me.
I will give you a picture and I will ask you the position in the picture. First, what is in front of the man?
Pen and a paper.
What is on the left side of the man?
A cardboard.
On what side of the man is the computer?
On his right side.
What is behind the man?
A window.
In spatial perception, the total score for each components are 4 points. The components are directions on client's body, spatial relation between client and object in near space, and spatial relation represented on a picture. 4 points indicate maximal performance and 1 point indicate minimal performance.
Imitate my movement as if you are looking in a mirror.
Okay.
I give you these objects. Show me how to use these objects.
To comb your hair. Practice breath.
For pencil and eraser, draw a line on a paper and erase it. I will give you instruction and you will show me how to do the instruction. First, show me how do you brush your teeth. How do you open a door with a key? How do you cut a loaf of bread with a knife?
Cut off the bread.
How do you use a telephone?
And then look.
In motor praxis, the total score for each component is 4 points. The components are motor imitation, utilizations of objects and symbolic actions. 4 points indicate maximal performance and 1 point indicate minimal performance.
I'm done. Okay, good job, guys. Okay, this is a picture. Okay, construct this pattern. Okay, I'm done. Okay. Now, try construct on the design. Okay, this is pattern. Okay, construct this pattern on the whiteboard. Okay, I'm done. Okay, nice. Thank you. Okay, so for the scoring for copying geometric form, which is the client able to copy 4 form for circle, triangle, diamond and square. And then for the scoring, she get 3 points, which is 3 points here. And then measure the time performance. So for the 2-dimensional model, the client only can copy the 2-dimensional on the design. So she get 2 points. And then so for the pegboard, which is she only can construct the vertical and horizontal line. So she get around 2 points.
Okay, now we will do a test about color board design. This will to test your ability to do a 3D, construct 3D design. So I will show you a design of the booklet and I will give you a block. So you need to do the exactly as this.
Okay, I'm done.
Are you done? Okay. Okay, now we will do a test which is plain board design. Okay, I will show you this design. Okay, how many cubes are needed to build the design?
6.
6. Okay, now construct this design.
Done.
Are you done? Okay. That's about puzzle reproduction. Okay, now construct the design on the design.
Done.
You done? Okay. Okay, now we will draw a clock. I want you to fill in the number in this clock and put the hand of the clock to the 10:50. Okay. you done? Okay. We will do a categorization test. There's a 14 cards. So I want to sort the card into a group. The group.
Transportation.
And what's the other group now?
Q.
Still put another possible way to sort them into a group.
No.
No? You sure? Are you sure? Okay. Group design. The marking is 2 because the client build the design flat on the table. For the plain block design, since the client doesn't build the invisible block, so as you can see, there's an invisible, so the marking is 2 as he build what he see. So for the reproduction of a puzzle, the marking is also 2 because the client only did the 3 central vertical piece. And then next is the clock. The client needs to the clock is 3. The marking is 3 because the client needs to do the general scheme of the clock like this, and then put the hand to the 10:15. She can do the marking scheme, general scheme, but she cannot put the hand of the clock correctly to the 10:15. So the marking is 3. And then next we go to thinking operation categorization subtest. The marking is 2 because client can only categorize 2 general group, which is tool and transportation.
Hi lesson. Okay, my name is Zeti and today I am your therapist. Okay, so we continue your last session of Lotka. Okay, today we are going to make the subtest of RISCA object classification. Okay. Here is some pieces of shapes. Okay, put these objects into groups that are alike. Now we move to RISCA object classification structure. Okay, I made this. Can you use these pieces to make like mine? Okay, good. How are your groups like mine?
Same color arrow, green, cream oval, and white half donut.
Okay, now can you use all these pieces? Okay, thank you. For pictorial sequence A, I give you these cards, 5 cards. Okay, arrange this picture in the right sequence. We move to pictorial sequence B. This is a 6 card, and may you arrange this according to right sequence. is geometrical sequence. So this is a complete figure of sequence. In this line, the forms are drawn in the spatial order. So now I would like you to continue the sequence according to this order. Okay, good. This line is ordered according to spatial order. Okay, now I would like you to continue this line according to the correct order. Miss Nasuha, we are at the last subtest, which is logic question. I'm going to ask you 4 questions and you must answer the question correctly, okay? This is question number 1. John was born in 1930. In what year was John 35? 1940. Okay, next question. Peter was born in 1950. How old is he now? 22. Okay, third question. Mary has 5 apples. Susan has 3 apples fewer than Mary. How many apples do both of them have in all? 7. Okay, last question. Nancy was born before Janet and after Sarah. Who is the oldest? Which one is in the middle and who is the youngest? Sarah. The middle is Nancy. The youngest is Janet. Sarah, Nancy, and Janet. Okay, good. Okay, thank you. Okay, for item 21, which is ROC unstructured, the patient sorts the shape like this. So the patient gets 2 marks because she makes 2 criterion of these shapes, which is the same shapes arrow and the same color here. So for other marks, you may refer to the manual. For item 22, which is ROC structure, she gets 1 marks because she makes the shapes exactly like mine, but she doesn't use all the pieces. Item 23 and 24, which is pictorial sequence A and pictorial sequence B, she sorts the card according to right sequence, which is this is pictorial sequence A and this is pictorial sequence B. All the cards is sorted correctly. However, the patient cannot tell the story because of her aphasia problem. So you may jot down at the comment geometrical sequence in the booklet, page 26 until 27. For page 26, the patient do it correctly, which is 1 circle and also 1 square. But for the page 27, the patient should do 4 horizontal line and 5 vertical line. However, she make it 5 horizontal line and 6 vertical line. So the patient get 2 marks because only the page 1 is correct, but the second one is wrong. For the last item, which is item 26, logic question, the patient answer wrongly for the question A and B. However, she answered correctly for C and D, and she scored 2 marks.